Okay, welcome to, for Tuesday afternoon. Okay. Are you running this, Bailey? No? Okay. I think we got.
Good afternoon, Commissioners. Kelly Grayson, the Clerk of the Board, and we are here to talk about your budget and how to spend your money. So we kind of went through last year's budget of what we spent and with the help of the Finance Department and to determine what will be for the next 2 years. And what we've spent and came up with these numbers. So you can see online, we've got 2025. That was the previous budget, and 2026 and 27, and how we have changed it. If it's in red, we actually raised it, which there's not that many of it, but we did raise it and just a little bit. So for our cellular phones, we actually have 5 phones now. When we went to the public records, centralize the public records, we got an extra phone, so that will show the cost in there. And in the dues and subscriptions, we've gone a lot online with DocuSign. Zoom has raised its rates. We've got Canva that we're using for our agenda, and then also Issue for agenda, and then some organizational dues, just some little things in there. So we had to raise that one $800 to cover for the next couple of years. And the next ones that are here, there's 6 of them that we have lowered. We lowered the meals and lodging to $10,000, and that is the commissioner travel expenses for when you are reimbursed for the meals and the lodging when you travel. Our other budget, we've lowered $1,800 to now be $600. We think we can, that's just other stuff that kind of goes and gets overflown, and we don't have a spot for it. Then we've got our mileage reimbursement that we've gone to $1,000, so it's a reduction of $1,000. And then tuition and registration, which is like the conferences that you guys go to, we've brought that down to half, and that would be $3,000. Also, the airfare was at $9,000. We've reduced it to $5,000. And we have taken away our Cowlitz County logo wear. So we've all kind of talked in the office, and if we want anything, we're just going to pay for it out of our pocket. And everything else from there, we kept the same. Some of the stuff we just can't really avoid. We have the TDN, the article, the legal notices that we have to put in. You know, we can't really do anything. We have to have a printer, and code publishing is putting the codes on. So anytime you guys change the code, we have to pay for that out of our office. And then we also need to keep our employee retirement, and our office supplies was really, really low. So we don't want to go back down again. We just put it back up to where that is about the amount that we have been using. So all in all, we've reduced it about a little over 15,000, which is a reduction of about 25% from this last year. You have any questions on the commissioners?
On the TDN invoices, are we going to look into possibly not using the TDN and other alternative sources of our public notices?
At this time, the county or the legislation from the state, we have to use our local newspaper. We don't have any other choice, but there is people out there that are trying to advocate for us to be able to use other means like social media or other ways of publishing that people actually read. But as of this time, that is what the RCW says we have to use.
People actually read. I couldn't have said it better myself.
Well, personally, yeah.
Well, that's why I was asking, is I'm not sure how effective that actually is at notifying the public.
I do know that a lot of the companies, they know that the process is to look in the newspaper, but we also have those things online. And so they can look at just the actual posting and then they can go on to our website and be able to find more information.
Yeah, I just find it a very ineffective way, just due to the fact that many people don't receive a physical newspaper anymore, and you have to
Right.
subscribe and pay to the TDN. So
Yeah.
I'm not sure that that's really our best way to get our word out, but
Well, and I would agree with you. I don't think it is.
yeah.
I think we're kind of stuck by RCW right now that you have to use your local paper, but I agree with you. There's better ways to get it out these days.
And I believe we were talking to legal yesterday about MRSC. Is it MRSC? They're trying to put out to get the word out about changing that because just times have changed and it's been that way for like 70 years.
70?
Yeah.
Oh, like
So it's
back
been a
when we
long
did
time since they've had
carrier
that.
pigeons.
Yeah.
Yeah, it's good stuff.
These, this is an easy one. I think there's 5 categories that you'd probably put under travel type expense. Is that the 3 of us or does that include some of you also?
It does include everybody. There is a separate public records travel
Well, that's what I
on the
see. And
next
I saw
page.
public records had some separate
Yeah.
stuff, so.
Kelly talked to me about that and I went through and added all those numbers up and actually divided it by 4, just because Kelly sometimes does go with you guys, which does equal out to 4,500 each a year for
Okay.
travel expenses.
Gotcha. Thanks.
All right, moving on to public records. This one's pretty simple. Flip it up. We didn't have to increase any of the budget lines. We did decrease the mailings. We kept the meals and lodging. There's some trainings and certifications that's required for our public records. And so this is still required for them to be able to go to these things. The reimbursement for their mileage, we did decrease that based on what they used previously. So we thought that was comfortable. And then the registration for the conferences for the certification, we were able to lower that too, based on where they want to focus on for next year. So, and all in total, that was a reduction of 48%. Their budget's pretty small, so any kind of lowering makes it look like it's a big percentage, but we did lower it.
I did just think of something on the commissioner's office. Since commissioners took over employee longevity, where is that in here?
That is not reflected in here because the policy has not actually changed yet.
Okay.
Yeah, once that policy comes through, we can work with Kathy to change that fund over to our office, which is an employee recognition fund. It's just, Kathy can correct me if I'm wrong. It's a separate fund in the auditor's office right now since they process.
Okay.
We just have a little piece of it because we order the plaques and the marble for the retirement. And then the rest of the budget of that is with the auditor's office.
And will that be coming over to the commissioner's office?
If the policy is approved and the way that we would like to change how it's been done, yeah, it would move over to our office.
Which I believe when I checked, there was 18,000 in their fund. I don't know if I can talk more to Amy Filippello and Carolyn about it, but I don't know if that's solely used for the employee recognition events, but if it is, then I would just envision ours would increase from 1,000 to 19,000, but again, that can be looked at and adjusted.
Any other questions on the public records? Our next one is Board of Equalization. That one is, we took over a couple years ago, so now we're getting more of a handle of what the budget would be able to look like. So we were able to reduce it significantly, so 73%. One of the big ones was the professional and contract services. That one we just kind of kept in there because initially when they did it down in building and planning, they would invoice their hours over to be reimbursed to the department. So it was coming out like a contract. And then, but when we did it, we moved it to a percentage of our administrative assistant's salary. So when she gets paid, just the portion is put on the salary part. Is that a good way to explain it? So we did reduce that budget by $1,500. And I think we'll be fine for this next year. We have a new volunteer. They are paid, but very little. They get $60 for each day that they do. But we have a new board member. He will be going to the training. So we'll be reimbursing him for his mileage. But that should be coming up here pretty soon because they're starting the dates on the Board of Equalization. So you should start seeing some of that.
Do you remember
in
who he
office.
is? Placing Laura?
you remember?
Is it Cameron?
Cameron, yeah.
Cameron
Svensson?
Svensson.
Svensson.
Oh, okay.
I think that's it.
You have a,
Where's the candy fund?
Oh, we have.
Bailey's.
We're gonna take,
We cut those from the budget.
yeah, we cut those
I
from the
don't-
budget. Any donations?
Thank you. They accept donations. I know that.
You can leave me a tip on my, yeah, for candy.
Yeah.
All right, well, we'll turn it over to Kathy then. And Susie.
Thank you.
Thank you.
So our next department is going to be the coroners. So we'll have them come up and walk you through their budget for 2026 and 2027.
Morning, Commissioners.
Morning.
So Christy and I had put together a bunch of numbers a while back, so I just kind of added that in here. So when we were going through the budget, different line items and stuff that we could cut, as you can see, office supplies, we cut 500 out of that. Uniforms, we cut 3,000. Morgue supplies, another 2,000. Small tools and minor equipment, 100. Minor equipment, 46,000. And I think that had a lot to do with the gurney that we had. So, yeah. Professional and contract services, that's our biggest item. And I kind of went over the reasoning for that last time I was in, and that had to do a lot with our Randox machine that we're
Oh,
gonna
that's right.
implement.
Yeah.
Yeah, so without having Dr. Nelson at a contract of 120,000 a year, our professional contracts and services was at 275,000. I cut 100,000 out of that down to 175. I'm thinking we should be able to do okay with that without having Dr. Nelson, and then also having the Randox machine, which I have kind of a breakdown of that in a little bit. Then we shouldn't have to have as many autopsies. And utilize NMS toxicology lab. We can hopefully just utilize WSP, which doesn't cost us anything. Indigent burials was at 5,600, and we get a really good deal from the place that that we're having our indigents taken care of. So I cut that 4,900 because I think last year we were about a little under 700. So I cut it down to 700. Mileage, we cut 200, tuition and registration down to 700. Or sorry, cut 700 out of that. We do have a few deputies that should be getting certified, so we'll have to pay for that. So that's should be included in there. Airfare, we cut 600, repairs and maintenance, 500. Copies, it was only 36, but we cut that down. Dues and subscriptions, 650. Printing and binding, we really don't do that, so I just cut that out. It's only $50, but, and then in our other line item, we cut it 500. So if you can see, our approved budget for 2025 was 1,360,446. 2026 and 27 budget should be 1,238,554 with a budget cut of 121,892. And then I just kind of broke it down from the budget item. The cut items was at 384, 336, and then the new one is at 224, 600. For the total for all those items is 159,736. On this one, I kind of just broke it down for you. Christy pulled numbers for what we had for autopsies last year in 2024. Just kind of breaks it down to, in 2024, we had 79 full autopsies, 6 were infants and 73 were adults. With that, over on the other side, it states what we get back from the state for autopsies. For children under 3, we get 100% back. So that's with toxicology, autopsy, everything. And then our autopsy reimbursements with all of that included for anybody above that is 40%. So the total cost for 2024 was 173,700, not including toxicology costs. So, which I've stated before, if it's a pending, so most likely drug related, pending toxicology, then we send to NMS toxicology lab, which costs us more. Dr. Nelson had 55 full autopsies. That's not including the consults and viewings and stuff like that to go over cases with him. So, but he performed those 52 adults and 3 infants. And then contract amount, 10,000 a month for 120,000 a year. Average cost of each autopsy equaled about 2,181. And that's including the infants and children, which I think I had mentioned before. Other pathologists, they have a different rate scale for different cases. Infants, children are more, homicides are more. Dr. Nelson was just a flat fee for, didn't matter what it was. Dr. Alexina completed 20 full autopsies, which were 17 adults, and that was an average of 2,100 each, totaling about 35,700. 3 infants, the infants were 3,200 each, so that was about 9,600. So we took his total for the autopsies was 45,300 last year. Dr. Burt completed 4, and then those breakdowns are there. So we paid her about 8,400. And then the total consults. So Dr. Dr. Nelson, it was a flat fee for whatever autopsy, consults, anything like that. I could call it at any time. Now, other ones that if we call and ask questions, they usually charge a fee. I think Dr. Luxina's is 350 for consults. And then externals are 1,200. So it's, it does cost us more if we have a different pathologist, but there's nothing we can do about that now. So the total cost of autopsies, including full external and consultations, was $175,250 last year. The next page goes over autopsy reimbursements. For 2024, we had a total reimbursement of $84,050.17. Total reimbursement for the first half was a little over 42,000. And that also included the toxicology and all of that. Total charges for the adult autopsies was little over 88,000. 40% of that was came back to us, and that was 35,368. And then infants and children was about just under 7,000, 6,876, and we get 100% of that back. So the second part for reimbursement. So reimbursement is January through the end of June. I have to have it in by July 15th, something like that. And then from July 1st to the end of December, and then February 15th is when I have to have that second portion in. So we don't ever see that second half until the following year. So that was 41,805. With total charges for adults was 75,723. 40% of that coming back was 30,289.57. And then another 11,515 for the infants and children.
Dana, how long does it take to get that reimbursement?
What's that?
How long does it take to get the reimbursement?
It usually takes a little while to get it. I don't even remember when it came back. So how it happens is we all submit for it. We have to send it to the state. And then they look through everything. Then they cut a check to the treasurer, the Washington Association treasurer, which is also on the FIC board. So he takes care of all of the reimbursements for everybody. So then once he gets that, he deposits that, and then they get cut back to us. So actually, no, I'm sorry. I'm wrong. I'm thinking of the other reimbursements. That one I think comes directly from the state. Yeah, but he also helps out with that, facilitating everything and stuff. So I would say it takes probably at least a few months.
So are you pretty tight at the beginning of the year because there's things that you pay all up front to the county internal
Mhm.
services, and then you're waiting for that reimbursement?
Mm-hmm.
Are you pretty tight that first little bit? No?
I don't think so. I think we're pretty good, because that's all coming out of, that all is coming out of our professional services. So we have that in the beginning of the year, and then we draw from that.
Okay.
So did you have something?
We're also a part of the general fund, so
Yeah.
there is plenty of cash balance in that fund at the beginning of the year.
And
So
The reimbursement just go to the coroners, right? I'm assuming it does. It doesn't
It goes to the general fund.
to,
Back to the general.
yeah,
but like the doctors, if they do something and send it in, they don't get reimbursed reimbursed. Yeah, it's really to the
Yeah,
coroner's offices.
yeah, the doctors
Anything we
don't
do with the
get
doctors is
reimbursed for
just
that,
a
yeah.
contract between you and them.
Yeah, it's for the doctors, it's a contract between us and then we pay them. And then we keep track of all of that and then we submit for reimbursement at the end of the
Gotcha, yeah.
term. Yeah. So this one is kind of on the Randox machine, just to give you a little bit more information. The Randox machine is an analytical instrument that performs clinical chemistry tests on blood samples. So it's a in-office way of finding out a little bit faster than sending it off to the lab. So they used to have only the qualitative data, so it didn't really do much for us. And so I didn't think it was feasible for us to spend money on that when we could just do one of our in-house tests, which I had explained to you before.
Mhm.
But now they have the quantitative ones. So they were actually down last week working on that, updating it, and then training on how to use that. So Christy was going over that with me earlier today. It's not exactly what I thought it was going to be, what they keep saying it's going to do, but we should still be able to use it pretty much like we thought. And then it'll still have to go, the blood samples will still go to WSP toxicology lab because it's a board certified laboratory. And then we'll get those back. But from what I've heard from other counties that use it, they say that it's pretty close, that it's not like super far off to where we would have to change something and it would make a huge difference there. So, but we should be able to, we should be able to utilize that. It will allow us to sign death certificates out sooner instead of pending them. And so families will have results sooner. It will also allow us to utilize the information better to determine whether or not we do need an autopsy. And what I say with that is because of the drug-related ones, we have a lot of drug-related cases that come in that don't have any medical history to back that up. So they will need an autopsy in order to make sure that we're not missing something. And if the toxicology comes back not high enough and we didn't do an autopsy, then that's a problem. So covering our bases there, but this should help us in determining whether that's going to be necessary or not. So we should be able to cut down on those. And then it'll help eliminate the need for utilizing NMS toxicology lab, which costs us money, and we can just send it to WSP. NMS, I know this is, I've gone over all of this stuff with you guys before, but NMS costs for standard, it's about $158 a test. And then expanded is about $243 and plus. It depends on if there's certain drugs or whatever that we suspect or know. Some of those are an additional cost because they don't come in that group. They're individual ones. So, but it should help eliminate on that too.
Dana, are there any ongoing costs with that machine?
Yes, our annual cost is $8,000. So, and then each test is about $50 compared to $153 and $243. So, and then if it comes back with something, then we can also eliminate the $2,000 plus for an autopsy. So it should, in the end, it should be really good for us. So utilizing, the next page is utilizing the Randox machine to cut autopsy and toxicology costs. So there's just kind of a breakdown. In 24, we performed 35 drug-related deaths that were autopsies due to lack of medical history. So that alone was about 73,500. And that's at 35 times just a flat fee of 2,100. So if we can utilize this machine to say, yes, they have a certain level or whatever, then we can, we wouldn't have to perform an autopsy for that, cutting a cost a great deal. And then I kind of went over that. So Christy broke it down of if it's for those, if we had this then for $50 for each case times 35, that would have been $1,750. And then average cost is about $243 for expanded and $158 for average NMS, which I already explained that. So if you go 35 times 243, that's about $8,500, which is still, I mean, way less than
Yeah.
what we would without it.
So about a little over 10,000 compared to 73,000.
Yeah,
Yeah.
exactly.
Yeah, that's quite a difference.
Yeah. So yeah, if you consider, well, say maybe about say about 16,000 if for the annual fee for it for the 8,000 and then doing the 243 for NMS would have been that. But yeah, if you did the 8,000 and then just the $50 for 35. So yeah, about a little over 10,000. And then the next one is just kind of showing you a breakdown of tox only. That would be if we know they're drug related, they come back with drugs in their system, but they also have medical history, then we wouldn't do an autopsy, but we would send it off and pend the death certificate. So we would send it off to NMS, and that's where we would have the expense of the toxicology. So, and that's just kind of a breakdown for that. And that was, I think Christy said there was 24 of those. So that cost was about just under 4,700. So. And then I just did the conclusion. I believe that the coroner's office should be able to assist the county in the budget reduction in the main areas of autopsies and toxicology expenses by implementing the Randox machine with the new quantitative testing. This is not and will not eliminate autopsies. Standard autopsies we'll still do those. It's just mainly going to eliminate the drug-related ones that would typically not need one as long as we knew. So cutting back on those would typically not be necessary with drug-related overdose deaths. With the rising amounts of drug-related deaths across the United States and nationwide, the process will allow us to know the levels within minutes. I think it was about 30 minutes? Yeah. So the results come back in about 30 minutes. As to sending the toxicology off and paying to have it expedited or performing an autopsy in cases that the levels aren't high enough. So.
One of the major cuts that you had, Dana, was your indigent burial expense.
Mhm.
How did it go from where it was last year to where it's at this year? Did we go from like actual burial to cremation or what? What
Oh,
happened?
no, we do cremation for indigents. So we pay we pay very little. Most places have to pay, and it goes off of the funeral home on what they're willing to work with us. And when I put it out there, when I took over in 23, when I put it out there, I only got, well, I got two back, and the one that we had, they came back at way lower than anybody else. Typically, it's about 500 on up per indigent. Some counties end up paying the full price of 25, 3,000. Yeah, so we're very fortunate that way, that we've gotten them to work with us on that. So, and that goes for transport, coming up, picking them up, taking them down, taking care of them, and bringing them back. So. So I think we had kept the budget at the same amount, but that's why we never used close to that. I think it was kind of put at that because of the costs in the past, and our indigents are just going up. Now, I don't want to just say indigents because a lot of them are unclaimed. So families just won't step in and take care of that. So then it ends up falling on the county.
Good job on your reduction. What's that?
They can
Just refuse paying it, leaving them there?
Yeah, and I really feel like that needs to go back to legislation to do something about that, because most of our people, I did at one time, I figured out how many, we have them listed, whether they're abandoned by family, and that's what we label them, abandoned by family, because they have family, but families just, they won't step up, or they don't want anything to do with them, or, you know, so it's pretty sad to think that, but we'll label them abandoned by family, or a true indigent is one that absolutely has nobody. And that's where it falls on the county, but the other one ends up falling on the county too, because there's nothing in legislation that is going to push for them to do anything. Any other questions?
Thank you. Good job.
You're welcome.
So our last department is going to be Parks and Rec.
We can just recess if she comes in.
I did try to message her, so hopefully she is able to come sooner.
She's got a big territory covered.
She might be coming from Cougar.
There's somebody coming down the Woodland Highway at 100 miles an hour.
Yeah,
I'm teasing.
in a county vehicle.
We'll just recess. Okay, we'll move back out of recess and
Afternoon, Commissioners. Sean Riley from Public Works. Today we are here for the 2026 Parks Budget Review. Want to? Ooh, sorry. It's the first time using this touchscreen. This is exciting. Just an overview on kind of the Parks Department itself. Maintains 11 county parks. We have 2 full-time FTEs. We have Alyssa here with us as well. Usually we have 3 summer help to help out in the summertime, keep that grass cut, and make everything look good. And then getting into the actual budget of it, there's not a whole lot of significant changes. We have one very large item over 2 years, and then our repairs and maintenance is always a floating item, depending on what kind of projects we want to correct or keep on going. A big one for 2026 is the Riverside bathrooms. Melissa can give a little bit more information on that side of it.
Yeah, so we have 4 restrooms at Riverside. 2 of them were remodeled a couple years ago with a grant from RCO. Now, the back 2 bathrooms have not been updated since they were built in the 70s. The plumbing needs to be updated. The whole thing is not up to ADA standards, so it's time.
You're looking at RCO for some help on that again, or is that's just us?
Yeah, that's
Yeah,
us.
okay.
I tried to go for a repairs and maintenance grant a year ago, and they're not gonna have those again.
Oh,
So it's one of those
Okay.
things where they don't really fund projects like that. It's
Yeah.
more of new things.
yeah, okay.
And within the budget itself, you'll see that Parks has a second bars numbers associated with it. That's gonna be for Harry Gardner Park. We do separate those dollars out, because we do have a volunteer group out there. I'm not sure if you guys are familiar with that, or if you are, we can give you more.
This is the one
detail.
out by Tootle, right? Yeah.
Yeah, so we have the Friends of Harry Gardner Park group. They're actually the ones that brought the park back. And they do a ton of volunteer work out there. So great group.
And then on the bottom line here, we do have an ongoing liability with Riverside Park in conjunction to property sales from 2016 and the RCO grant program. So just want to keep sure that's on your minds. From a revenue point of view, the park doesn't have a lot of revenues. It's mainly gonna be bookings, either at Riverside for picnic tables, pavilions, or at Harry Gardner for campsites or RV sites. Not a lot of change there. The larger project we want to talk about, though, is the Riverside Legacy Park we looked at. That does have some revenues associated with that, with the RCO as well. And then we also have some of the local dollars, more from the rural development and the Cook Ferry dredge spoils accounts.
The ball fields like at Riverside, do we get anything off of that, or is that just league uses them, or however we do it?
They use them. So for the softball fields, they do a lot of the maintenance on the infield. We're responsible for the outfield. And then we don't charge money for that.
Okay.
It's
so
more of
it's
something for the community to do.
Kind of reciprocal thing. They
Mhm.
take care of some, we do. Okay. Yeah.
Isn't it?
And then from here, really turning over to Alyssa to talk about the Legacy Project and the ideas there.
So the project itself, it's gonna come in basically, we're gonna do it in 2 different pieces. So the first part is gonna be the new playground. That's one of the playground models I'm looking at. We're gonna come up with two different ideas. And then I'm going to take it to the elementary schools, and the kids at the schools are gonna vote. So whichever playground has the most votes is gonna be the one that we decide to purchase. So it's kind of our community outreach part of our grant.
And I believe Sven handed out some handouts that showed some additional concept ideas. I don't know if you had a chance to review some of those.
Monkey bars are old. That's not so cool anymore. Although my daughter likes them.
We might have to vet those through risk. I just wanted to add, so Savannah Clement Public Services, just working with Alyssa on that RCO project. What you're looking at is a conceptual design that we worked with AEDA on to provide us for, grant funding, pursuing grant funding, and also to take with us to the DC trip to try to secure more funding. And an update on that is we were able to, thanks for the rural development funds of the county committed to this project, able to meet our goal for the full funding of this project. So, for Kathy and for the board, thanks again for that, because that put us kind of over that finish line to start ramping up on the actual project. So we're pretty excited.
So this slide basically shows what a pump track is. There's always that discussion of what is a pump track, and that's a picture of one right there on the left. The picture on the right is basically, it's just an idea of what it could be designed like. Each pump track that's created it's special, it's unique to its own specific park. They're not just a model that you buy and that's what you get. This one, we're going to be working with a separate group, bike enthusiasts that are going to help with the design portion. So another part of community engagement.
Alyssa, you kind of shared something this morning. We met before this afternoon's meeting earlier today, and I was under the impression that Longview was pursuing a new pump track, which would have put 2 in our community, which would have been great. Alyssa just told me that that is not moving forward because their funding fell through. So we will pretty much have the only newer pump track in the area. I think Ridgefield's putting one in.
Ridgefield supposedly is putting one in. They made a post about it on Facebook, but the closest one is Portland, and that one is packed. And it's overused. Pump tracks are really popular right now because anybody can use them, any group, skill level. You got kids on Strider bikes, you have BMX bikes, you have mountain bikes, skateboards, scooters, you name it, anybody can use it.
So it's really designed around a lot of wider range of uses, unlike Kelso over there is that be more of a
So that's a
skateboard?
yeah,
type
that's a
thing?
skate park. This is for anything that has wheels, basically, you can use on those.
Can they, I know because I've seen a couple people, they post, they do bicycle races. Would this host anything like this, or is it just more for?
This is gonna be more
Neighborhood
for
fun.
neighborhood fun. Those tracks are millions of dollars. That would be
okay.
great, but you know, that's something that's a big deal. I mean, they have huge competitions on them. Yes, I've seen those. But this one's a
Okay.
little bit smaller.
All right. Cool.
I don't think my quad is gonna fit on that very well.
No,
Is it open for motorized vehicles?
no.
Well, Riverside's the place for it, and then Lexington, that's just a growth area.
Yeah, and the whole idea is we were trying to find something for teenage kids to do because we have this age gap where there's nothing for them to do out in Lexington. So this is something that anybody can use.
I did want to add on one slide, because I just found this out this morning too, is, you know, the park board makes certain decisions that affect our local park system for Cowlitz County anyway. And they have been discussing looking at addressing some fees at Harry Gardner. I don't know if that'll move forward, so it was not included in this presentation, but that's something that we would likely bring to the fee schedule, and it would affect revenues for Harry Gardner Park. But we don't know for sure where that's going to go. But if that comes up and you wonder why we didn't go over it, we just don't have the information yet or the approval from the board. So.
For like people camping and hooking up.
Yeah,
Yeah.
so that's for tent sites and RV sites. It wouldn't affect picnic sites or the pavilion.
Do you have any issue with, I don't think that we do. Do you have any issue with long-term out there that
So
sometimes they tend to like turn into people's homes?
Mhm.
You know what I mean?
So we have a 7-day stay limit right now. So after 7 days, they have to leave for 3. Every winter, we usually get 1 or 2 that they stay for 7, they leave for 3, and then they come back for their 7.
Okay.
But I don't really have any problems, and any problems that we
Haven't had any
have.
problems, okay.
Yep.
And then we really just want to open up for questions or conversation with the board on parks itself.
I did have one question while you were gone, while you were on your way. I got asked about painting pickleball lines on the courts out there.
Oh, yeah.
What was the question?
We would do it
Can we redo it?
if we would paint pickleball lines on. the courts
So
out there.
the lines have been painted. They were painted 3 weeks ago.
Oh, cool.
Mhm.
So there's pickleball courts out there.
Yep, so there's 4 pickleball courts, 2 have nets, 2 do not. People bring their own nets, and then we also have 1 tennis, and it's all painted, and the basketball court is also painted.
Cool. I will let them know. Thank you.
Mhm.
I don't have
Yeah.
any other questions.
Good.
Thank you.
Thank you, guys. Appreciate your time.
Is that all till tomorrow, Suze? Okay. Guess I don't see anything else then. I think we're good. We will adjourn. Thank you, guys.
Thank you.
Appreciate it.